The last one that I remember was a young palliative patient, a young patient who had been diagnosed with stage 4 ovarian cancer. And she was a young lady in her early 30s, I forget the age. And she initially was very opposed. We had the gyne oncology team had begun doing had tried cycles for chemotherapy. They had tried debulking surgery, and but the disease just we were never ahead of the disease. And towards the end, she was then sent to the palliative clinic. So part of my clinical work, I do lead and support the palliative team in Kijabe. And she was then brought to the hospital. And as we walked through the different things, because we'd usually review the systems systematically, we'd ask about any physical symptoms, any emotional concerns, any psychological things that are unmet. And we got to the spiritual side, and I asked her, how is it with you and God? And she just really broke down. And she said, I know I'm about to die. And I know that if I died now, I would not meet Jesus. And she had been brought up in the faith, but then deviated, backslid, and this was a wake up call back for her. And and I was like, it doesn't have to be this way, you can turn your life back to Christ. There is always time, and not that there's always time, but the Lord would always accept you back. And He still loves you, and He's still stretching out His hand to you, because as we can see clinically, we know that you're about to meet Him. Yeah, and she did give her life to Christ. And a few weeks after that, she did pass on. And that was sad, but it was great knowing she had done that with a sense of eternal hope. It's truly a privilege to partner with God in this way.